Hi, I'm Katharine Buek. I have a bachelor's degree in psychology from Davidson College, a master's in public health from the George Washington University, and a PhD in human development and quantitative methods from the University of Pennsylvania. For the past 20 years, I've been conducting research in health and education programs that are aimed at improving well-being for women, children, and families, both in the United States and globally, focusing on some of the most vulnerable populations. My work is really geared towards developing evidence that helps to inform the improvement of programs and services that families and children receive. I've evaluated programs at the state and federal levels. I've conducted large-scale surveys. I've done qualitative work with healthcare professionals, and I've done a lot of secondary analyses, and I've used large data sets to conduct sophisticated statistical analyses, identifying patterns of risk and change over time and geography. So a lot of my research focuses on clinical and systems level factors that shape early childhood development and maternal mental health. So for example, I've led a statewide survey of pediatricians to understand their practices regarding screening and referral for developmental delay for children under age 3. I've also surveyed postpartum care providers about their knowledge and practices related to depression screening in patients and referral for mental health care services. And I've worked with nurses in postpartum care to understand their practices and attitudes towards engaging fathers in the care of newborns. I have published and presented my work, a lot of it related to perinatal care and child maltreatment prevention. I've published in journals including BMC Nursing, Child Maltreatment, and Early Childhood Research Quarterly. I've also presented some of my work at conferences including the American Public Health Association and the Society for Prevention Research. One project I'm especially proud of used large-scale data on child welfare outcomes and perinatal health indicators to look at how use of health services was impacting infant maltreatment. So we were able to identify how certain healthcare risk factors impacted reports and outcomes of infant maltreatment in the first year of life after birth. This analysis was used to help identify priorities and targets for better prevention efforts. So when I work with students, my goal is really to help them produce something tangible, something that's going to be very useful, whether that's a research paper, a poster presentation, or something that they can include in an application. I've supported students in developing projects from refining research questions all the way through the analysis, and then helping them to develop products that they can present clearly and confidently. So my approach to mentorship is really to provide a structure for the student, but let them take the lead. I want students to feel that they fully own their ideas and their process and their products. My goal is to break the research process into clear and manageable steps so that nothing feels too overwhelming. But I also want to emphasize critical thinking skills with my students. I want them to understand why they're doing what they're doing and not just tell them what to do. I think one of my greatest strengths as a mentor is the depth and breadth of my experience. I've spent many years conducting research across sectors, from health research to education to social and economic development, and I've used a number of methods in my work. That breadth of experience allows me to adapt my methods to different research topics and questions that are of interest to students, but also to recognize where there are potential pitfalls and challenges in the research process that students are likely to encounter. And it's really important for me to help students understand that these challenges and setbacks are all part of the process, and they're very valuable aspects of the research process in general. Personally, I'm very passionate about mentoring because I'm very passionate about research, and I believe that it's important for students to understand not only how to produce research, but how to consume and interpret research that they'll have to come across and use in their work later in life. I think when students realize that they can take an idea, analyze it, and contribute something new to the field, that's a really powerful moment. I love helping students build the confidence and develop the skills that they can use in their research projects, but also in their graduate school and in their career later in life.